Today, I want to talk about when Bartonella treatment fails. So before I do that, for those of you who are new, welcome. We're so happy that you're here. And for those of you who don't know me well, my name is Dr. Evan Hirsch, and I specialize in helping people with fatigue get their lives back. And I'm on a mission to help 100,000 people do that. And I do that through my book. So I've got it on Kindle, I've got it on paperback, and I basically took all of my protocols and dumped it in there. I tell you exactly how to go about ordering your labs, how to interpret your labs, what treatments to get. And then I also have one-on-one consults, and right now I'm working on creating online classes that we'll talk about more in the next couple of weeks. So let's dive in here. When does Bartonella treatment fail? So for those of you who are not that familiar, so Bartonella is an infection, oftentimes travels with Lyme, and sometimes when people think they have Lyme, they actually have Bartonella. Usually the symptoms associated are headaches, neck pain, problem sleeping, usually problem staying asleep, and or falling asleep. There'll be anxiety and depression. Big symptoms are pain on the bottom of the feet or foot pain, and then muscle cramps, usually in the calves, in addition to those other symptoms that I mentioned. So that's Bartonella. So how do we treat Bartonella? And then we'll get into when treatment fails. So a lot of people in the group, it sounds like, have Bartonella. They've taken the Bartonella quiz. They're ready to treat their Bartonella, and they say, hey, I've heard that you talk about ABART from Byron White formulas. Let's go at it. So going right at Bartonella will have some success for some people. So with the ABART drops, it's by Byron White formulas. It's a combination of herbs that are very potent. I start people off with usually one drop, either on the bottom of the foot because it's so potent, or in a little bit of water, and you do that every night, and then you increase every week by a drop. Now the problem becomes, so the nuances to this treatment are that you will start to get die-off if you're not taking enough detox support, and that's usually in the form of Detox 1 and Detox 2, BT Detox, NT Detox, by Byron White formulas, if not some other things. Coffee enemas, there's a number of other, glutathione, number of things that can be really helpful for that. So you have to open up those detoxification pathways like I do first thing with everybody starting on this path, regardless of what their causes are, is that you have to start opening up those detoxification pathways. So that's the first thing. And then you're on your ABART and you're ramping up on it. And generally symptoms, all those symptoms that I mentioned for Bartonella, will start to get better. Now, so for about, I don't know, I would say 25% to 30, 40% of people, you're going to start to get that improvement, okay? And sometimes the ABART can get you all of the way there, though that's probably about 10% of folks. But it will get you, you'll definitely see an improvement in your symptoms. But what happens when treatment fails, or we're getting to a certain point, or where, let's say you're 10, 20, 30% better, and we can't get you any better than that? Or what happens if, let's say we start you on the ABART and you have really bad die-off and we can't get any sort of improvement at all on the ABART? What is happening? So what's happening in these cases is that there are other usual suspects that are present. Heavy metals, chemicals, molds, other infections, allergies like food allergies, food toxins, inhaled allergies, toxic emotions, toxic relationships, trauma, and electromagnetic frequencies that all might be upending the immune system and causing a problem. So as a reminder, we cannot get rid of infections unless the immune system is there and helping us, okay? So, and the biggest one of these is mold, because everybody who's watching this, not everybody, but a lot of you are saying, there's no mold in my body. And I can guarantee that more than half of you, that is the problem that I run into with so many people, is that they don't remember that, or they didn't think it was significant. Like your home flooded every year when you were in the home that you lived in when you were 5, or you had a water leak, or the house smelled musty, or whatever it was. You don't even know that you had mold growing up or in a place that you lived, and you have it in your body, and it's not allowing your immune system to help you get rid of these infections. And oftentimes mold can look a lot like Bartonella. So that's why it's so important to take a look at these. Mercury, lead, all of these toxins are so important to pay attention to in order to treat Bartonella. The other thing is that sometimes you can get rid of Bartonella entirely, or I should say bring it back into balance, so there's really not much Bartonella in the body, but your immune system is still reacting to the Bartonella. So this is when we use something called LDI, or low-dose immunotherapy, that resets the immune system, that changes that relationship between the immune system and the bug. So, most of these bugs, unless you get a big inoculation from a tick or a mosquito or something like that, where you're just getting a whole bunch of this bug at once, most of these bugs we have in our bodies, and we've had in our bodies since day one. We got them from mom through the placenta, and they haven't been a problem until you stack up these stressful events and these usual suspects. So oftentimes I'll have somebody come in who said, I got into a car accident, and now I can't sleep, I have headaches all the time, and burning on the bottom of my feet. And they're like, it's got to be from the car accident. And it's like, actually, the car accident, the stress, physical stress from the car accident, maybe some mental, emotional stress from it too, no doubt, upended the immune system and allowed the Bartonella that was in your body already to take hold. So, indirectly, directly rather, the motor vehicle accident has kind of caused this problem, but it's not from the motor vehicle accident per se. It's because of the Bartonella that has been triggered. So those are some important things to keep in mind, and I will talk more about the LDI. But for all of you who want to treat your Bartonella and you're like, give me the A-Bart, I'm ready to go, I am trying to figure out how to get you the A-Bart, but get it to you safely, because that is the concern that I have. And if you Google these Byron White formulas, there's a lot of people out there who say, I started on the A-Bart and it totally caused me to flare, it broke up my biofilm, and now I'm even worse than I was before. And that's not what I want for you. And obviously if I'm one-on-one with you, I can do it because I can manage all of the nuances, but I'm trying to figure out how to do it safely for a group of people. And so taking you through a class to be able to do this is really going to be where it's at, and that's what we're working on. So I hope this was helpful. Please leave your comments and questions below, and I will get to them and answer those, because I do want you to get rid of your Bartonella. It's going to change your life, but we have to do it safely, and we have to do it carefully. So if you like this video, please give it a thumbs up. Share it with someone you think it will be helpful for. If you're watching this on YouTube, subscribe to our channel. Thanks so much for watching, and have an amazing day.